So, hip flexion biased indirect approaches, right? So, not because this is the way that you would do it for everybody, but because if I ask you to work on a particular movement and try to find the ability to make the soft tissues in and around the hip soft with hip flexion bias, you are working on hip flexion and the skills and the holds, making those better with a clear target. So in lateral, it is very obvious if you watch me across time, in almost every situation in lateral, I'm going to work from behind the patient. So I have to reach less. However, to generate hip flexion, I have to reach less when I'm in front of them because of the direction I'm going. So if I'm behind and I go into hip flexion, I have to reach with my arm to pull it up. How serious was that a snack? Oh, nice. Okay, sorry. On video, not editing. So, contact is control and control is safety. If I want to generate hip flexion, there are multiple ways I can do it. I can go active first. I can palpate as she goes into hip flexion. When I'm palpating as she goes into hip flexion, I am not going to find softness. If I go passively into hip flexion, I can palpate while I'm passively going. So I can do things like go both legs, right, until I find some softness, because I don't have to lift the top leg, and then I can start to do things like this. Now, look, I'm rolling the whole torso, the pelvis, that's not working, but if I start to tune in there, so I'm paying attention here, yeah, okay, you felt it already. And then that seems softish. Yeah. Okay, it's not perfect, right? But I position with both legs, I get to a place where it seems to kind of superficially soften generally, where I think it's firm, and then I can modify off the knee, but I have to be careful because I can rock the whole person, right? That's a problem, right? I can use good contact in multiple ways when I want to lift the leg. So what I would do is that, oh no, thank you. I was trying to be slick. I was trying to shove her other leg out of the way with my knee. Now I have her positioned on my knee, so I'm not holding. This is not hard for me, okay? So in this case, it's my down table leg. There may be cases where it's my up table leg. The point is I have my shin on the table. She is resting on my thigh, right? It's because I can do this. I can do stuff like this. Compression and distraction are not going to work well because I'm going to roll her no matter what I do. Even when my hand's here, if I try to compress, it's just hard, okay? So again, say here-ish. You are good described video. I really shouldn't pick on you so much, Heather. Sorry. Okay. So you see how I'm using my abdomen here? Because it's contact. But so my abdomen and my thigh are able to control, say, up, down, towards table, away from table. Like softish, right? Yeah. Not great, but it's under the circumstances. Like that's not going to make it better. That's not going to make it better. But this makes it pretty damn good, right? It's a really weird movement that I'm doing, but it's working. Bend both knees a little bit just so that they're more together. Thank you. You can sit and do a very similar thing. Thank you, Michael. So you can do it both legs, or you can do something along these lines, right? This is not going to work as well under the circumstances, right? I'd have to do something maybe a little bit more like this. Maybe about there, right? Small movements. It's hip flexion biased, but I still have to do all the small movements to find it. I have high reason to not believe that going active is going to help this. Fair enough? Okay, cool.